to bring everybody's attention here so we can start at 11:20, not 11:15. I want to welcome you all for coming down and staying for a little while. We are hoping that these programs will last 30 to 45 minutes, so you'll still have time to go to lunch and do whatever. As the pastor explained, this is a new initiative by the mission committee that we want to have every third Sunday, every other month. We plan to have a program for the community and for us to get information about what is happening in our community. So this is our first third Sunday, and we are going to have other programs already talked about and lining up for starting in September. We're going to take the summer months off. So we're planning to do things from CASA, Paladine, drug court, which my daughter-in-law is part of. We hope to have a speaker on environmental issues about the things that are happening on the shoreline, our shoreline. So these are just part of the programs that we hope to bring you. It's also something that we're doing for the Matthew 25 initiative that our church is taking on. And the Matthew 25 initiative is building congregational vitality, eradicating systemic poverty, and dismantling institutional racism. So our first speaker is Melissa DeSutter. She is the center manager for the new PACE program at Franciscan Hospital in Michigan City. PACE stands for Program of All-Inclusive Care for the Elderly. Melissa was raised in Indiana, went to Ball State. She left us for a while. I guess Colorado was a better draw. And now she's back. And she's back to being a Hoosier. So I'm going to let you tell everyone about why you came back.
Okay, thank you. All right, I just want to first make sure, everybody can hear me okay? Are we okay in the back? Okay. You know, I always just like to double check because there's always someone who can't quite hear right, and then they feel bad to say, hey, turn it up. So I always like to check. Does everyone have these two different handouts? I just wanted to make sure. Okay, perfect. If somebody walks in and they need some, I put them on the background table over by those four gals. So if someone needs it. Well, first and foremost, thank you so much for inviting me to be here today. We are super excited about the PACE program and the PACE model. So I'm really excited to speak with all of you. As Janice shared, I am from Northwest Indiana. I grew up in Cherville. I went to Ball State. I spent about 11 years in Colorado. Yay. And yes, it was lovely. I go back every year to go visit people. And you know, I just have to say, it's not that I'm a Hoosier again. I've always been a Hoosier. Like, it never leaves you. Clearly, I'm back. And, you know, a big reason I am back is for family reasons. My folks are here, aunts, uncles, cousins. I have a little girl. She's 6 years old. And, you know, sometimes life throws you some curveballs, and you decide that you want to be closer to family. I know when we were communicating, I grew up knowing all of my grandparents as well as one of my great-grandparents, also all from Northwest Indiana. And so that was just important for me too, for my daughter to have closer connection with her grandparents and aunts and uncles and whatnot. So as far as the PACE model and this presentation today, I'm very okay with keeping it kind of informal. So if I'm talking about something and you have a question, I don't really believe in having to wait till the end. If you have something right then and there, please feel free to raise your hand and I'll answer it right on the spot. So one thing with this PACE model, before I get started, I kind of like to do this activity where I ask everybody to just take a minute and think of a person in your life, it could be one or a couple, who is an older adult. And I just say the term older adult because depending on who you are, some people don't like the term senior, some people really don't like hearing elderly or a youthful older adult, whatever you want to call them. And there's differences as far as what is that number exactly. So just take a minute and think of that older adult in your life, and I want you just to think about all of the reasons that you care about that person. And it could be a family member, it could be a neighbor or a colleague, it could be a spouse or a parent. It could even be an adult child that you're concerned about as well. So think about that person, and now I want you to also think about all of the areas where maybe you're concerned about them. And maybe you're not concerned about them right now in real time, but you're thinking toward the future and you're not really sure what that looks like. So for example, you may be having conversations with this person who says, you know what, no matter what, I'm gonna stay in my house. I don't know what that looks like, but I'm never leaving my house. You may have someone in real time that needs a little extra support, and maybe they are not really wanting that extra support or willing to accept some extra help. So kind of think of that person as I'm walking through what this PACE model looks like. So as Janice shared, PACE stands for Program of All-Inclusive Care for the Elderly, and this program is across the United States. So yes, I work for Franciscan, I'm a Franciscan employee, but I do want you to know that this PACE model of care is something that's currently in 32 states across the country. So it's a little bit newer to the state of Indiana, but it is not new to our country. So I like to just share that background so that you know that PACE is part of a greater network across the United States. So what is the point of this PACE model and what does it look like? How does it work? So the reason that this program started, and it started in the 1970s in the Bay Area, in the San Francisco area, and it was started by families who were really advocating kind of at a grassroots level for a different level of care. So these were families who were listening to their loved ones and did not want their loved one to go to a nursing home when they're older. And so they wanted something more community-based. So this is how the whole program started. It was by families who said, hey, my loved one wants to stay at home. They don't want to go into an institutional setting. How can we make this happen? So that's how it all started. So since the 70s, it's been growing and expanding across the country. And kudos to Franciscan. They actually brought this model of care to the state of Indiana about 7 years ago. So there's a PACE right now in Indianapolis, there's one in Dyer, Indiana, there's one here, and then later on this year, probably like August or so, there'll be one in Lafayette as well, so it's growing. So what is the whole point about PACE, Program of All-Inclusive Care for the Elderly? The whole point behind this program is to help that older adult live as independently as possible in the community as long as possible. So you hear me say as long as possible. Well, what does that mean? We know that the care needs are going to increase for the people that we are serving. They just are. And so what we're trying to do is really help coordinate and support that senior and their family so that they can have their loved one in their own living environment for as long as possible. So how is this model, how does it work in terms of eligibility? So you have to be 55 years or older to be in this program. You have to live in our covered zip code area. For this particular site here in Michigan City, it is all of LaPorte County. It's a little tiny piece of St. Joe County, and then it's most of northern Porter County. So it's a pretty big catchment area in terms of the area that we serve. I do want to just touch base too when Janice was introducing me in terms of the location. So this program actually lives in the old hospital location. So if you've taken a little ride, you've probably seen all the construction and wondering, like, are they going to pull the building down? Is it just a new parking lot? What are they doing? So they're actually renovating the space, and we are located on the first floor. Most of the first floor is where PACE is located. And if you haven't had a chance to go in there, it is astounding. Like, it is beautiful. They completely renovated the space. It's very nice. There's also going to be a park that's being built as well. Do you guys want me to shut this door? Is that okay? Is everybody okay? I'm okay. I just want to make sure you're okay. Oh, poor little guys. Those are rough times for sure. So does everyone know where that is on Homer Street? The main entrance is actually the old emergency department location. If you remember how to get into the ED, that's where PACE is located right now in real time. So what does this program look like? How is it different than what I say the non-PACE land? So in this program, all of the services, medication, care, hospitalizations, any kind of services tied to the person's health care you can imagine, it's all under PACE. PACE manages everything. So how do we do that? We have this interdisciplinary team of professionals, which includes primary care, physical therapy, occupational therapy. We have a social worker, we have a dietitian, we have transportation, there's a driver, we have quality folks, a home care coordinator to help with different service lines, home health aides that are part of our team, nursing. It's a really neat model because nowhere else in healthcare is everyone sitting at the same table and saying, hey, what's going on with Mr. Smith? He seems different today. What's going on? And in this model, we're looking at everything. Like, what are your medications that you're taking? What do those services look like? What equipment do you need? What supplies do you need? And you have all of these different professionals really discussing and collaborating on behalf of that person. So going back to where I started originally, that person in your life that you care about maybe has a primary care doctor, maybe they have a neurologist also, maybe they have a cardiologist as well, maybe there's more providers who are part of their care team. So in the non-PACE land, all of those doctors are amazing. They're all doing the best they can to help their patient, but nobody actually sits down and says, what's going on here? So neurology is prescribing this, cardiology is doing that. Nobody's really talking. The other piece that's neat with PACE is that we're looking at that picture, and we consult with a pharmacy group too on the medications to make sure, like, does it really make sense for you to be taking these different medications when your other doctor is prescribing this? And it's really it's no one's fault. It's just the way our system is designed. It's not the best because when you're not collaborating, it's hard to know what everybody else is doing for this single person. And in PACE, we can really look at the big picture.
You don't change doctors, though, do you? I mean, if you come in with a certain doctor.
Great question. Let's go there right now.
Yeah,
So,
interrupt when you're talking
No.
about the doctors getting together, so you keep the doctors you had.
yes. So let me answer that question for you. So at PACE, we have a clinic on site. So if you were to come to Homer Street and see what we're doing, there's an entire clinic, there's 4 examination rooms, there's a therapy department for like physical therapy, occupational therapy. There's also a day center as well, which is, more life enrichment. So on the question about the provider, like, do I have to switch my doctor? So the short answer is kind of yes and no. On your primary care doctor, PACE becomes your primary care doctor, okay? So I want to just explain this to you because I know some people get a little nervous. This model is unique in that we are the provider of all the services, but we are also the payer. So we're doing both. So we're authorizing the visits, we're also giving the visits. So when you're in PACE, we become your primary care. And if you have a primary care doctor right now, real time, that you're like, you know what, Melissa, you seem nice, PACE, I'm not changing my doctor, bye. I get it. A lot of people do have those thoughts. We will allow you to go see your primary care doctor that you see in real time 2 times a year if you want to go see that doctor. And I get it, because it's a big switch to move your primary care. It's a big deal. And so we allow you to go see that doctor if you want twice a year until you feel more comfortable with us. With that being said, we're still your, I guess, super primary, if you want to call it, your super primary care, but you're still allowed to go see that other primary care doctor in case you're a little bit nervous about this and you're not totally ready to, cut ties with that primary care doctor. And the reason that we do that is that we are very intimately involved with what is going on in your world and all of your healthcare needs. And, primary care, they do so much. And with our team, we take it to like a higher level because we're engaging all of these other disciplines that I was telling you about who are right down the hall. Everybody's there at the same place. So let's say you come in for an appointment. The other thing that's unique about PACE is that there isn't this, waiting room with a lot of different people and maybe they're running behind. Again, that's our current model. It's just how it goes. Then you're like, hey, my appointment started 15 minutes ago. I'm not going to say sometimes we may be running behind too. I mean, life happens, but it's totally different. And when you come in, it's very common for you to spend anywhere from 30 to 90 minutes with the provider. So the reason for that, again, we are your provider, but we're also your payer. So we want to make sure we know everything inside out so that we don't miss anything. Because if we miss something, it could result in like a hospitalization, and we don't want that. We don't want that to happen for 2 reasons. 1, we're trying to take good care of our people, but for 2, if something happens, then we are the ones that are paying for that level of care. And so what I'm saying with that is there is zero incentive for us to cut any corners at all in terms of getting to know you.
So, Melissa,
Yes.
does that also apply to specialists?
Good question. So she's saying, does that apply to specialists as well? So the short answer is sometimes, not all the time. So for example, everyone knows that we're with Franciscan. It's a Franciscan program. The idea is to try to keep all the doctors within Franciscan with different options. Now we understand there's a couple of challenges with that. 1, you may have like a cardiologist who's amazing and there's a really good rapport there already, and you already have an appointment set, and then the Franciscan cardiologist maybe is backed up for 6 months. So we don't want to cut your specialist that already knows what's going on and can see you already on the schedule. So we kind of take it case by case with the specialist. The idea is to try to convert everybody over. But to be honest, all the systems are really stressed and maxed right now. And so we are not going to switch you just because like, hey, we want you on the Franciscan bus. If we can get you to stay where you are and it makes more sense, that's what we're gonna do. That's especially an important question too if you have folks who who may be struggling with different mental health challenges. Sometimes it's hard to find different providers who will work with those different kinds of issues, and so we don't want to change that. The last thing we want to do is bring you in and like shake the snow globe and everything's crazy. Like, we don't want that. We want to go slow with any kind of change in transition, and we also want to make sure you fully understand what you're getting into with this program. So let me back up just a tiny bit as far as that eligibility. So you've got to be 55 years or older. You've got to live in our covered zip code, okay? So when I say live in the covered zip code, you just have to live there. You don't have to own a home there. You don't have to be there for 2 or 3 years, nothing like that. You can live anywhere as long as you're in those county lines that I was talking about. You have to be what we call at risk for nursing home level of care. Now, there's a lot of detail behind that in terms of what that looks like. It's something our team determines, so it's nothing that you need to go home and be like, hey, are you at risk for nursing home level of care because of this program? We will sit down with you and we'll learn a lot more. But I will say, if you have people in real time that you're like, gosh, I don't know, I think something's off over here, we can definitely determine and see, like, does this make sense for this person to be in this program right now? And if not, maybe later. Then the other criteria is that they have to be able to live safely in the community. So it's kind of like an interesting spot, because you're like, okay, this person could go to a nursing home, but they're still good. Like, they're still okay at home. So it's kind of an interesting little area. So things that we're looking for is in terms of determining that eligibility. We are looking at the person's cognition. We have people in the program right now in real time that are very physically, they're fine. Like, there's not a whole lot going on with them physically. They're very mobile, but cognitively they struggle. They've got some different challenges going on, and it's not always safe for them to be alone, like, at all. So that's something that we're looking at. If somebody were to need support with getting dressed in the morning, if they're having some challenges getting to the restroom, if you are someone you know who's going to the hospital a lot for different reasons, those are all things that we're looking at. And if for some reason the person doesn't meet criteria, like, we'll walk you through that and explain to you, hey, this is what's going on. You're actually doing too well to be here. But let us know when things kind of teeter a little bit and call us back. But a lot of times there's definitely multiple things that are going on. And they're very private conversations. They're very personal conversations. It's not always one where, you want to necessarily bring the entire family, but we have that too, where everybody brings, like, the whole gang, and that's fine. Whatever works for you. In terms of the process, when you're enrolling, it's not one of those programs where you're like, hey, you know what? I want to be on PACE on Monday. Like, let's do it. I want to be in the program. It's much more involved. And I share that just so that I can kind of manage expectations. So for example, if we have Mr. Jones over here, and I'm going to just say he's 78, and he maybe has some cognition issues, maybe he's not managing his diabetes very well, maybe he has some heart problems right now. First thing that we're going to do is ask that family for a release of information so that we can reach out to all the doctors, because he has multiple ones, and request all the healthcare information. So our team can really go through, decipher, read everything, and really have the whole picture. And we go way back. So, like, even the ladies in the room, like, we will go back to when you had children. I mean, we're literally reviewing your whole health history. We want the whole picture. And it takes a little time to kind of run through all of that and learn. And then what we find, and I'm sure this is no big light bulb for anyone in here, is that, oh, wow, this doctor was doing this when that person was doing this, and did you know that those things cancel each other out? So nothing's actually working just for that one tiny little thing. It's really neat because our team can catch multiple areas where the care could be so much better, but because nobody talks to each other, it makes it really hard. So as far as that enrollment process goes, of course, we want you to come for a tour. We want you to meet the team. There's a pre-enrollment meeting. There's a post-enrollment meeting. You meet with the different team members before you enroll. This program, you can only enroll on the first of the month or first business day of the month, but you would be active with PACE on the first of the month. That may be changing at some point, but I don't think anytime soon. So technically there's only 12 times a year that you can be in the program. And it also kind of depends on when you call us. So right now it's mid-May. Depending on some different things, you could enroll on June 1st, but quite honestly, it probably wouldn't be till July 1st, just because there's different pieces that have to be coordinated. The other piece that I want to talk about as far as eligibility is the insurance piece. So this is a CMS program. So I don't know if everyone's familiar when someone says CMS. So it's Centers for Medicare and Medicaid Services. So government, Medicare, Medicaid, PACE. A lot of people, because again, it's new to Indiana, they hear PACE, they're like, what's that? It's newer. And so if you go on the government website where there's all the different types of insurances, also Medicare Advantage programs, so you may be running in your mind right now like, oh, well, I have traditional Medicare, but I have a supplement. Is that okay? Is that okay? You can have any kind of payer source and be in this program. It just will look different depending on what kind of insurance you have. So let me answer that because it's usually a huge question. So if somebody that you know, and you may not even know what their insurance is, and just so everyone knows, you don't need to know anything about anything to call us. It's okay. I know you're like, it sounds like a lot of work to like even answer the questions. We get it. That's why it also takes a little bit more time. So let's say that you have someone that you know who has both. Like you can have Medicare and Medicaid at the same time. That's called a dual eligible. There's a lot of people that have that. So if you have both, it's pretty smooth to get into the program. If you have Medicaid only, again, it's pretty smooth to get straight into the program. If you're someone that has Medicare only, the first thing that we check is to see, is this somebody who really should be on Medicare? Now, it's a question that doesn't really come up very often unless maybe you have some different professional friends who are like, you may get more services if you had a different payer source. And you may also get conflicting information about what that looks like. But with PACE, if you have Medicare, the first thing we're gonna do is see, is this somebody who really should be on Medicaid, okay? It's something that we check because once you enroll into the Medicaid program, it slides super smoothly for PACE. There's lots of different questions that we ask to determine if you would be eligible. Sometimes families, just being completely transparent, like they don't want to talk about that and they start getting like nervous. They're like, oh my gosh, PACE wants to put me on Medicaid. What's going on? We're not really putting you on Medicaid. We're seeing if you're eligible for Medicaid. And then if you are, we can start that process to get you into Medicaid to then smoothly enroll into PACE. Now, with that being said, for folks that do meet criteria, and there are income questions around that, there's financial questions and asset questions. There's a lot to it. It's complex. But if you are someone who's on Medicare who really should be on Medicaid, it is definitely worth looking into because the way that the future looks as far as services available, it's very different depending on your insurance. Okay, so let's say Mrs. Smith here, she has Medicare. We ask her questions. Oops, I should be on Medicaid. I don't know what to do. PACE will help you with your application to get it submitted so that you can enroll into Medicaid and then transition into PACE. Now, let's say another person, they have Medicare. There's no way they're ever going to be eligible for Medicaid. It's not going to happen. Their resources are too high. Their assets don't work. It's not going to happen. So you can still actually be in this program if that's not the case. So we have people right now, yes?
What's the difference between Medicare and Medicaid?
Do we have like 17 hours? No, I'm kidding. Okay, so the question is, what's the difference between Medicare and Medicaid? So I think the shortest answer I can give you right now is I'm not an expert on Medicare and Medicaid. But what I will tell you is that they are both identical in that they are both government programs. Now, sometimes when people hear Medicaid, they think like a stigma, like, oh, that person didn't do something the right way, because there's different income thresholds for Medicaid, and what your monthly income looks like, and it's lower. It's a lot lower. And so the services that are provided to folks who receive Medicaid, they're greater. They're more plentiful. So for example, one example I can give you is a tiny little difference. If you needed to have a private caregiver and you're not receiving Medicaid, there's like a Medicaid waiver program, which would then go away if you joined PACE. But you could have a caregiver in your home and not pay anything for it if you were with Medicaid. In Medicare, there's no way. You have to pay privately out of pocket for that kind of service. So for example, if somebody needed to come in to help with meal prep and cleaning the house and things like that, that's kind of just one tiny example. It's also very different in terms of accessibility for different mental health services as well. Different procedures, different everything. It is a different ball of wax, but they're both government programs, and so is PACE. So if you are holding like a Medicaid card or a Medicare card, either one, and you join PACE, this card, it doesn't go away, it just transfers to PACE. Now the card says PACE, like your insurance card says PACE on it. Some people get a little nervous about that because they're like, oh my gosh, I'm in this new program, what's going on? If for some reason you don't like PACE, you always have the option to disenroll. If you don't like it, you can always disenroll and go back to whatever you had on before. So that's an option as well. Caveat on that little go back to what you had before. If you did transfer to Medicaid, you would go to Medicaid and you'd still have access to all those additional services. The other piece, just to kind of keep in mind, going back to that example. So let's say that it is someone who has Medicare and their resources are too high. They're never gonna qualify for Medicaid because of what their financial world looks like and what their assets look like. And so in those situations, that individual has the option to pay privately to be in the program. Now, I will tell you, like in real time, Michigan City, we have people right now who are in all those categories. Paying privately, folks that transitioned to Medicaid, and then people that had both Medicare and Medicaid. So it's not just like one population of people, it's diverse. So that's kind of nice too. What that looks like, and again, I just want full transparency because I don't like surprises too much, especially when it's very serious stuff like healthcare and planning for the future. So usually when someone calls us, something's not right, like something happened. Maybe somebody fell, or maybe this is a couple and the spouse recently passed away, and now they're seeing different problems because the spouse used to do different things for them and now they're alone. So usually when someone's calling us, they're like, okay, we don't know what to do. We don't know where to start. And so for those families that have Medicare in real time and they're not going to be eligible for Medicaid because of financial reasons, they're shopping around for services and they're trying to figure it out. So for example, a family the other week came in and they're like, okay, so should we go to a memory care, or should we hire a caregiver 24/7, or should I just drop her off at the senior center and like hope for the best? Like, I mean, this is like real. I mean, I guess I'm like more real talk, but it's true. I mean, that's usually, they're like, I don't know what to do. I don't know what to do. And who pays for this? And a lot of these services, if you're not on Medicaid, you have to pay out of pocket for them. And so I have no problem sitting down with anybody and just like showing the math on how some of this looks. You know, I don't want to quote all of the different assisted living environments. There's definitely time and place for those folks, and the caregiver agencies too. But it can become very costly, is what I will say, very quickly. So you want to understand like the value that you're receiving for what you're paying, because there's a lot of extra, I guess, detail in the background that you may not necessarily take into consideration. So for example, let's say that in real time you're like, well, I guess it's assisted living time, let's sell the house. And then, you know, your sister's like, I'm not selling my house, forget that, I'm staying forever. And, you know, everybody's fighting, nobody likes each other now. It's like holidays are coming, everyone's like, I'm not bringing that pot dish thing, no, I'm not doing that. No, forget the roast. I'm not coming. Like, I mean, it's real. Like, we know. You're laughing because you know I'm right. Like, it gets really interesting. So, what's kind of neat about with this option is, hey, what if we can provide all of these services in a way to keep you in your home, and also from a financial standpoint too, being kind of mindful of your resources. So to be in this program each month, if you don't qualify on the Medicaid side, it's about $5,000 a month to be in this program. So one thing I want to share, if you are able to find an assisted living that's $5,000 and that's it, like period, like give me a call because I'd be curious. I'm not trying to be smart, but it's kind of interesting. There's a lot of extra that you have to pay for in a lot of those environments. So we're big on education over here. We're big on transparency. The other piece too is that we also work with assisted livings and nursing homes and caregiver agencies. So right now in real time, we have multiple participants in the program. We call them participants because we want them to participate in their care, that we PACE pays a caregiver agency to go out to that loved one's home. We also will provide transportation to bring that participant into our day center, which is a Monday through Friday program. And it's really neat. I mean, it's very neat in terms of socialization and interaction. And so there's different ways that we can kind of piece this together. The other thing that's neat in terms of this as an option, and I understand PACE is not for everybody. It's not. I mean, sometimes people are like, whoa, you guys are kind of in our business. And we kind of are. Like, we know a lot about you, and not everybody likes that. And I understand. That's why it takes a little while to get into the program too. We want to make sure you really, really want to do this. There is no hard push or sell, because if you get into this program and you don't like it, like that was a lot of work to get you into the program for it not to be good. So we don't want to rush you. We really want you to feel good about it. So the other part, as families are kind of trying to figure out, does this work, does it not? I always encourage families too to think about, what are you going to do as the care needs increase? The other thing that's neat about this program, and I am not an attorney, but we definitely refer families to go and talk to like estate planning or elder law attorneys. This program can also count as what is known as a spend down. So I don't know if you've ever heard that term before. So basically, in a nutshell, if someone's trying to qualify for Medicaid, there's different ways that you can spend your money down where you wouldn't be punished for it. There's lots of rules around that, and I'm definitely not going to answer any of those, so please don't ask. But PACE does count as a spend down, so you're not penalized if you're paying the PACE program and trying to kind of figure out your financial picture and bring your resources down a little bit. The nice thing though with PACE is that it never changes. So if Mr. Smith 1 month is like costing the program $17,000 a month and he's paying us privately, he's just charged the same as the one who's costing, $2,000 a month. So you're still paying the same amount every month regardless of what your care cost looks like. You don't see the bills. That's nothing that you see. You just pay PACE, and we manage all the other pieces behind the scenes. Yes, sir, you got a question back there?
Yes, when you're currently on Medicare, you actually are paying into that program. That payment is deducted from your Social Security payments. Is that payment directed to PACE at that point in time?
So the question was, you're paying into Medicare, and he's asking if that payment is then transitioned to PACE. Is that what you're asking? Is that okay? So, so the short answer is not really. When you enroll into the program, what's going to happen is you're going to have to have your monthly payment to us, okay? Because right now you don't qualify for Medicaid. So we're trying to get you to qualify, if ever, for this program. When we're doing that, and each case is super, super, super different, we sit down with you, and I will tell you these meetings are long. We have an entire department that works with you one-on-one to really see what's going on with your individual situation. We do cover, now this is getting like a little bit more in the weeds. So for example, if you have like the Medicare D for drugs, for your medications, PACE is now paying for that. So in that case, that piece would go away. Now, you may be on some different Medicare products and services. And again, you guys are probably gonna fall asleep on me here. I want you to know that you may call one of your Medicare reps or a product that you have, like a supplement, and they will probably say, it's not annual enrollment. You can't make any changes to your benefit until the fall. It's not annual enrollment. You will get that message. So I want to tell you, and I'm okay, I see this is being recorded too. With that being said, that person is either just not knowledgeable about PACE, okay? And I'm gonna say that I'm hoping that's what it is, that they are not knowledgeable about the PACE program. The second piece is, that's not true. You can enroll into the PACE model anytime you want and change the benefit. Now, I will tell you, again, depending on your situation and everything that you have as far as your coverage, we really walk through all of that to make sure it all transitions super smoothly. We don't really want any surprises. So I guess going back to your original question, it kind of depends on what's going on with your different products, and making sure that all of that stops the second that you're coming into the PACE program.
So if I could actually sort of put a basket around this, PACE is an alternative in relationship to both Medicare and Medicaid.
It is an alternative, yes.
Medicaid is a state program where Medicare is a federal program.
So they're both different federal programs, and then there's state ways that you can participate in those programs. I know that's probably a little bit confusing. For example, so like with PACE is a federal program, but states have to opt in. Like for example, Michigan, huge. PACE is huge in Michigan. Illinois, it's not there yet. So there's different ways that the states can kind of determine how they're going to participate. Another example would be, so there's Indiana Medicaid, there's Illinois Medicaid. We live really close to Chicago, but yet depending on like your age and your need, you might have to go to Indianapolis for care and not Chicago, which doesn't really make a lot of sense because it's 5 seconds. But it's different state, but they're both federal programs, but there's different rules. A lot of this is super complex, so I do want to make sure you understand, I'm not an expert. I mean, I know enough to be a little dangerous, but there's a lot to some of this. And I will tell you, when you enroll into the PACE program, we go slow to make sure we don't miss anything, because there's no incentive for us to make a goof, because that's a mistake for our program then too. So we want to make sure we've got all your questions answered and that everything goes smoothly when you join the program. Go ahead. No, you're good. Go ahead.
In regards to your circle of care, what if you have a complaint? Who do you take that to?
I love that question. Okay, so the question is, what do you do if you have a complaint? So all you need to do is tell one of our team members. We take any feedback super, super serious, and there's a lot of rules around this. So this is a government program, And in government programs, there's lots of rules. So when you have a question or a preference or an idea about how care should be driven, we take that very, very seriously and we look into that. So here's an example. So we had just the other week, somebody wanted an electronic wheelchair. Okay, they don't want to use their wheels anymore. They want one they just push the button, you know, like the Cadillac one. And so this was a request that was made to our team. So every single time that there's a request like this, we take it very, very seriously. In this particular situation, the individual just was like not wanting to really move their arms anymore. Now, was this a choice to not move your arms, or it's like you can't move your arms? So it's a couple different things. The other piece too is if somebody is in a wheelchair that's electronic, a lot of times they stop doing things that they used to do because they get so reliant on the button and the little lever, which causes them to really deteriorate with their strength and can also increase falls and then hospitalizations. And so we walked with the family through all of this. And in this particular case, the electric wheelchair was denied. However, what we did do is say, hey, you know what? Let's bring you to the center for an extra day for more physical therapy. Or let's come out to your house. Our whole idea is to keep them where they are for as long as possible. And once we talked with the family more about this, they understood. And if you don't like the answer too, I mean, you may be like, I don't care, I still want my wheelchair. You can still go through another process to go another level to have your voice heard on that. But it is a transparent program. I mean, we're not shy about how the decisions are made, and they are interdisciplinary. So it wouldn't just be a physical therapist who's saying that. It would be the doctor weighing in as well, and also talking through the different reasons for that decision. Does that answer your question? It could be anything. It could be, hey, we authorize 20 hours a week. I want 40 hours a week of a caregiver to come to my house. Can I get that? What does that look like? So there's lots of different ways that people make requests. Yeah, you in the back, hon?
Yeah, with the, you said it's in 32 states. Say you're approved for PACE in Indiana, but then your kids want you to move to a state where PACE does exist. Does that transfer automatically?
Okay, so the question is, what if you're in a PACE state like Indiana, and then what does it look like if you go, because I worked for a PACE in Colorado, let's say you're going to Colorado, it is not a smooth transition to another PACE program. And I would say it's probably even more so when you're jumping into a new state. So what would have to happen at that point in time, you'd have to disenroll from the PACE program. I am certain that our team would call the PACE in another state and say, hey, look, we have Mrs. Smith here. She was with us. She's moving. She's going to be there by June 1st. And then I'm sure that team would want to meet with you and everything before you would enroll, but it's not smooth at this point in time.
I think your question also was, what if you move into a state that does not have PACE?
Yeah, if you move into a state that does not have PACE, then don't move there. I'm just kidding. You're not going to get it. Like, if it doesn't exist, it just doesn't exist. And I think there's lots of reasons the program may or may not be there yet. Like I said, I mean, it's barely in half the states right now, but it's growing momentum. And the reason that it is because statistically, people will live longer if they're in the PACE program. I mean, if you think of somebody totally managing your medications, and also you have 24/7 access to our team. So let's say it's 2 a.m. on a Friday, or Friday night or Saturday morning, and something's not right and you're not sure what to do, you can call us. You can call our on-call. It's somebody from our team. It's not like some third party in Minnesota or something. Like, we know who you are. We know what's going on with you. There's a lot of people out there who just get a little scared and then they run to the emergency department or they call an ambulance when really it's not something that needs to be at that level, but they just don't know. And so you have access to our team 24/7, which is a huge, huge deal for families. Yes.
Program in Texas?
Yes.
Good, because if I enroll in it here, my son's family lives in Texas.
So one.
I'm alone now, I'm a widow, and I have nieces and nephews in the area, but I'm able to look after myself now, but I just turned 90, and I'm not
Yes.
going to be able to do that very long. So, if I enroll here, would it be possible to transfer that to Texas?
Okay, so a couple things first. I cannot believe you're 90. You look amazing. I'm not just blowing sunshine your way either. Good for you. You look awesome. So a question was, if she moves to a different state that has PACE, if she enrolls here, would it transfer to that other community? You would have to disenroll from the PACE in Indiana and then enroll into the other state's PACE program. The other piece too is just because a state has it doesn't mean that community necessarily has it. So that's another little, I guess, curveball. Depends on what part of the state and do they have a program there. So like for example, somebody could say, you know, just in the state of Indiana, I want to go move to Bloomington, Indiana. I want to be in PACE in Bloomington. Well, there's not a PACE program in Bloomington, Indiana right now. Maybe at some point, but not right now. So just because the state has it, you're gonna want to triple check to make sure that the community that you're going to actually has it too. And I would start the conversation ASAP if you think you're gonna be doing something like a big move like that, because then they can start gathering your medical history and start reviewing it right now. But yeah, I mean, if you're going to hang out in Indiana for a while, we'd love to see you. If it's something you'd like to do. Yeah.
Well, I have two questions. So one, a person could live in their home and be in your program, that's correct?
Yes, so the question is, a person can live in their home and be in the program. Yes, they can.
And then you were mentioning about the cost of assisted living, nursing home versus what you charge on the person. Yeah. What kind of costs are incurred when a person's living at home? I mean, is it still quite high?
So the question is, what kind of costs are incurred when the person is living at home? What does that look like? So the shortest answer I can give you, it's really different for each person. So I'm so sorry. Let me turn my cell phone. It's beeping really quick. Hold on.
No crickets allowed.
So we have some folks who immediately day one, they need a caregiver in the home immediately. Okay, there's no time to wait and the family's maxed out. That's very common. So we're gonna start paying that caregiver agency quickly. We're also gonna be paying for all of your medications that you have, any supplies, oxygen. We have a new participant who needed a ramp put on their home because they weren't able to get out of their house safely if something should happen, or if an ambulance needed to be called. They had all these steps and they're in a wheelchair, they're kind of stuck in their home. So we're paying a contractor to go and put a big nice ramp on the outside of their house. Other folks don't have, you know, proper nutrition, or they're not able to go grocery shopping. So we're setting up meal services for that individual. And again, we know that the care needs are going to increase with time. So the idea with this program is that you're coming in before everything is really, really crazy, but we also have folks that come in where everything is, it's very challenging. Yes. So my short answer, I'm not dodging it, is some people will come in and maybe their costs look, one way, and then somebody else, it's something else. But the idea is anyone who enrolls in this program, we want to keep you through end of life, and we want to keep you as independent as possible through that time. And the way that we do that is also our therapists are coming out to see you. We're providing transportation for you to come to our day center. There's a dietitian. You have full access to our team 24/7. If you call us on a Sunday and you're like, I don't know what's going on, I think I need to come in tomorrow, we're gonna get you in tomorrow and not say, hey, go to the urgent care or emergency department, we're busy. Because again, there's no incentive for us to have, other unnecessary people involved if we can see you right away. But your care needs will increase with time, and they change. There's also a lot of people that are not able to drive anymore, and we can provide that transportation to all of those outside appointments. The other piece too is just the pure management of everything. So if you're a caregiver and you are managing all of the doctor's appointments, you're setting up little med dispensers, those kinds of things, like putting everything together, you're not going to do that anymore with PACE. PACE does that. We put it all together for you. So it's done. It is a huge gift to caregivers who are doing it all, literally doing it all. Yeah, you in the back, go ahead.
Yeah, you mentioned try to make the program the end of life.
Correct.
Then if you're in the PACE program, who's in charge of the palliative care or hospice? You bring those in?
Right. So there's only so much that we can do on our own team. We have to engage other professionals. So the question is, what happens if somebody is end of life and they need more of like a palliative or a hospice level of support? So in those situations, we will call those different hospices who have palliative, or we will do the palliative as well, depending on what's going on. But you're going to still get those services. Same with home health. So if you've ever known someone who had a nurse coming in for like a wound change, or physical therapist coming in to help them walk at home, all of those service lines fall under PACE. Some of those we're doing ourselves, and some of those we are contracting out. A lot of times it's Franciscan, but sometimes it's not. My team knows that if we need to get home health in there, and if for some reason we can't do that, Franciscan has too much going on, like we're not gonna wait, because that could be really, really bad patient care. So we're gonna go to someone else. We're gonna go to another contracted entity to make sure you've got what you need. Does anyone have anything else? Yeah.
Do you have to be alone, living alone, if there's a couple together, or two brothers, elderly brothers, taking care of each other? Do you, as the member of PACE, do you have to be totally alone?
No. So the question was, do you have to live alone in order to qualify for the PACE program? And no. There are lots of people who live with a spouse, who live with their kids, who live with friends. We certainly have people who live alone. I will tell you, we do have people who are definitely at higher risk and require more care if they live alone. So, back to your question, the gal with the the cute stripes and the little flower necklace thing. So it looks different if you have, one person too who lives alone who really needs a lot, and then you have this person who maybe has a spouse, but then that spouse is like, hey, you know what? I'm gonna bring my husband for the day center program 5 days a week. That's a really huge gift to that caregiver in terms of respite. Whereas this one, maybe they're coming also, but then, when they go home, they're gonna need more support when they go home because they live alone. I wanna make sure I'm clear too, just because you live alone doesn't mean you're like getting all the services thrown at you because you're alone, but we know that there's more risk too when you're completely by yourself. There's also a lot of people in the program who really have no one. Like they don't really have any help, like no family around. And they're really by themselves, big time. We do want the families to be involved. And a lot of times when they're enrolling into this program, the families want to be involved, they just don't want to do all of it. And it's a tremendous amount of work. If you've ever had to make the doctor's appointments, figure out how to get the person there, looking at the medications, all the pieces that the doctors are telling you. I mean, I have a master's degree in gerontology and it's overwhelming. Like, it's a lot looking at all those different pieces. And so with PACE, it's literally like an umbrella over everything. Okay, do you want to do one more?
Possible to be rejected by them.
That is an excellent question. So can you be rejected? I wouldn't call we reject you. I would say rejection, so harsh, right? No, I would say, yeah. Okay, so we don't say rejection usually, but we would say that you're not meeting criteria for one reason or another. So when I was talking earlier about we're looking to see if you're at risk for nursing home level of care or if you're able to live safely in the community. This is a story from when I was in Colorado. So there was this family and this person was already total nursing home level of care. Essentially this family, I mean, I had never seen anything like it. It was amazing and also like kind of heartbreaking and sad. So what the family had done, they bought a hospital bed, they bought a Hoyer lift. She was completely nursing home level of care. So that's known as total care. Like, you need 24/7 care. You can never be alone. Like, you're not able to do many things for yourself, okay? If you're already at that level of total care, it's too late for PACE. It's too late for PACE. So that's why, we're trying to be more preventative in talking about this, because we want to